This patient has just had brain surgery, but there was no incision, no pain, no lengthy recovery. There wasn't even a knife. Here at the San Diego Gamma Knife Center, located on the campus of Scripps Memorial Hospital in La Jolla, over 3,500 patients have been treated for metastatic brain tumors and other brain abnormalities. All of this with a high degree of safety, no hair loss, no scarring, no general anesthesia, and with a rapid return to their normal activities. Gamma Knife is the only method specifically indicated by the FDA for treatment of brain metastases.
Gamma knife radiosurgery, by its very nature, being an outpatient procedure, avoids many of the complications of surgery, such as the possibility of infection, bleeding, pain, prolonged hospital stay. If a patient can have the treatment, go home that afternoon, go back to work the next morning, I think that has tremendous value for the patient.
Our staff of neurosurgeons, radiation oncologists, medical physicists, and other specialists are the most experienced clinicians in the San Diego area and pioneered radiosurgery in the region, using dedicated equipment for brain abnormalities.
Well, I've had trigeminal neuralgia for approximately 4 years now, and it has been very, very, very painful. I can't function, I can't think, pretty much. The pain is just excruciating. It goes through the right side of my face, and it pretty much starts right above my lip and right to my brow, the corner of my eye, and back down, and it just is very, very painful. It's just gotten to the point where I can't think, I can't function anymore.
Trigeminal neuralgia is one of the most painful conditions a person can develop. It is one of the most painful conditions that we treat as physicians in all of medicine. Trigeminal neuralgia is characterized by what we call severe lancinating pain in the face. This pain is so severe that it can bring a person to their knees and they're unable to chew or swallow or do any other kinds of activities. Even wind can cause pain on a person's face in this condition, and they're shut in and unable to do anything, essentially.
And then when I would take a shower, I had to block the water from my face so that the water wouldn't hit my face, because just a little whatever sprinkles or whatever even hit my face, it would cause it to just shoot the pain to the right side of my face. And I couldn't touch my nose. I couldn't even scratch my lip. I couldn't even kiss my grandkids.
The Gamma knife is a wonderful development in the treatment of trigeminal neuralgia. It's a completely bloodless form of surgery, a way to make that trigeminal nerve act normally again. And one of the great benefits of it is that it's completely bloodless, there's no cutting. In addition to that, there is often a significant reduction in the use of medications and, of course, then the side effects. And some patients are really completely off medication as well. It's just a fantastic development for treating this very severe and painful condition.
I didn't want to have surgery done because I was very fearful of that. And I heard it was a very good treatment, so I thought that's the way I'm going to go.
Yeah, hi, Diana, Dr. Ott. And I'm going to discuss your treatment. You have trigeminal neuralgia.
Correct.
What side of the face is it?
On my right side.
And it's a sharp, stabbing electrical shock pain?
Very sharp.
And how long have you had trigeminal neuralgia?
About 4 years.
We're going to treat your face, the trigeminal nerve, with radiosurgery, a very effective way of treating this. We treated over 400 patients with trigeminal neuralgia. And most of the time, the pain goes away within a few days or a few weeks. So let me tell you how this is done. First of all, we're going to put a lightweight aluminum frame on your head, okay? That's fixed with 4 points. We use local anesthetic, and if you feel apprehensive in any way, we can give you some sedation. And then we're going to image your head. Fancy way of saying we're going to do an MR scan. So the MR scan will show us the nerve, and then we can target the nerve with the radiation. As you know, the radiation is extremely focused. So we will place your head in the frame inside the Gamma knife machine. The machine is fairly open, so it's like a CT scanner. It doesn't cause any claustrophobia. And once we position your head in the frame inside the machine, you'll just lie there on your back for about 45 minutes or an hour. And once that's done, take you out of the machine, frame comes off, you go home. And within a few days or a few weeks, the pain will slowly subside. And the effectiveness is great. About 85% of patients have significant pain relief, which means they have no pain on a little bit of medications or no medications at all. So let me discuss what the side effects are. This is a very safe procedure. It's completely non-invasive. Many patients, about half the patients, report a little bit of tingling in the face. Matter of fact, the patients who report a little bit of tingling seem to do better than the patients who don't. And once again, if the pain does come back in the future years, we can retreat it, and it's just as safe the second time. Do you have any questions about the treatment?
I feel good about it.
If you have no other questions, I'll leave you now, and Dr. Hodgins will be in here, and he'll talk to you, and then we'll get started with this pretty quickly, okay?
Okay, great.
You all right?
Yes.
Okay, good.
Thank you.
Brain tumors are a condition that can arise out of cancer that spreads up to the brain, or tumors that arise primarily in the brain. And these tumors can also be treated with the Gamma knife. In the old method of treating brain tumors, we often had to do what we would call a craniotomy, where we would cut through the scalp and the skull and open up towards the brain and remove the tumors. This was accompanied by risks, including bleeding and infection. And now with the Gamma knife, there is a completely bloodless way to perform this surgery without any of the cutting. These tumors will shrink and often disappear, and has been a great boon to patients who have this kind of significant and very severe problem.
Well, about 15 years ago, I woke up in the middle of the night with a roaring in my head and couldn't hear very well. I contacted my doctor, and he gave me some decongestant, which did not help. So then he asked me to have a test run of some sort. I went to a neurologist. He suggested I have an MRI, and the MRI showed that I had acoustic neuroma on the nerve from my ear to my brain. I went to a doctor that was associated with the Gamma knife in San Diego. He showed my husband and I the process that would take place if I chose the Gamma knife versus conventional surgery. So after we talked about it, we both agreed that the Gamma knife was far superior to a conventional surgery. They fitted my head with the brace, took the pictures they needed to take, and the Gamma knife itself took about 10 minutes. And I stayed overnight in those days because the insurance required it, and went home the next day and went to work right away. And I had no side effects whatsoever. And it showed with future MRIs that the tumor was dead, and it is still dead to this day. It's been 15 years, and I'm very grateful. Thank God every day that I went to the Gamma knife and I was able to have this taken care of so painlessly.
I was diagnosed with malignant melanoma in August of 1994, and I started on a FDA-controlled protocol, which is a vaccination for the treatment, and went along fine with a couple of minor operations until January of 1997, when during my yearly checkup I was informed that I had a brain met. That was pretty shocking news for me, because all during the course of my treatment I had been told that if you had a brain met, you were basically dead. So I was pretty upset, as is understandable. But the people at the center where I'm being treated told me, no, it's not the end of the road. There's something called Gamma knife, and you can be treated now.
For these patients, the Gamma knife is the treatment of choice. Because the treatment is based on precisely placed doses of radiation, preparation begins by attaching a lightweight frame to the patient's head. Measurements made with the frame in place will enable the team to plan the precise delivery of treatment. The frame ensures that only the affected area of the brain will be targeted, leaving healthy tissue unaffected. The frame is used because it is the most accurate technique for planning and delivering radiation to the target. It is the same technique used for conventional microsurgery of the brain. With the frame in place, the patient typically has an MRI brain scan to localize the tumor for treatment planning. Within minutes of the MRI results, the Gamma knife team, which consists of the radiation oncologist, the medical physicist, and the neurosurgeon, is at work. Using the very latest treatment planning software, they determine the precise placement and dosage of radiation. The patient is positioned in the Gamma knife treatment room, and a special helmet is fitted over the metal frame. The helmet has 201 guides through which radiation flows. The aperture of each guide can be adjusted to enhance the precision of the Gamma knife still further. Then, with the Gamma knife team at a control console just outside, the treatment begins. During treatment, gamma rays from 201 sources converge on a single point within the brain. Along the path of each individual gamma ray, there's only minimal radiation, with virtually no harmful effect. But where the rays intersect, there is a high dose of radiation and a highly effective treatment.
The Gamma knife and Gamma knife radiosurgery has given us a tremendous tool to use with metastatic tumors in the brain, and allows us to treat patients with small metastatic tumors or larger metastatic tumors and see them respond and survive far longer than they ever did before. This is a young woman who has metastatic breast cancer to her brain, and she presented with 2 lesions, one of them in the back right part of the brain called the cerebellum, and this here is the lesion that we're describing. And I want to back away a little bit so that we can see, get some reference as to where this is in her brain. This is the patient lying on her back. This is the back of her head here, the front of her head and her eyes up here, and this is a small lesion in the back right cerebellar hemisphere. This is the residual of that lesion now 5 months later, much smaller and in the process probably of resolving down to nothing. We've been able to use this approach using high doses of radiation to small tumors like this to keep patients like this going, as I mentioned, far longer than we ever did before. We've seen many patients live years after radiosurgery for metastatic tumors in the brain that a few years ago took patients' lives within a few months. I can't tell you the number of patients we've had who have seen their kids graduate from high school or college, or who have seen their first grandchild, basically because of this technology. This is another patient with metastatic tumors in the brain, and as you can see, we've outlined them, and in this 3D mode, we can really see where they are in the brain. We can rotate the images around to see that here we have one in the left parietal region. We have a couple of lesions down in the left cerebellar region, and it can give us an idea of where these are in relation to other normal critical structures in the brain. We can have the patient looking directly at us and get an idea of where the lesions are, or we can turn and see that most of these lesions are in the back part of the brain, and this is how we'll target them. This helps us in our positioning of the patient appropriately for this precise radiation treatment.
After I had the treatment, of course, everyone was relieved and very excited, but at the same time kind of fearful. I wonder if this thing will come back. So the real joy is when you go for your MRI 1 month and then 3 months later, and they come back totally clean.
I have the quality of life that I can spend time with my grandchildren and my children and my friends that I'm sure I would not have had if I'd had conventional surgery. Very thankful.
Having this procedure done at Gamma Knife was the best thing I could have done. It was fantastic to get my life back again. I forgot what it was like to live without pain. It was wonderful being able to hug and kiss my grandkids again.